I'm from Bali. I'm an anesthesiologist. Specifically, I'm a neuroanesthesiologist. I'm already in this field for more than 15 years. Where the anesthesiologist's main purpose is to make the patient safe through the critical period during his life, during trauma, surgery, intensive care, and a lot of critical event that could endanger patient life. So we should keep the patient in his physiological state, keep the patient safe, keep the patient comfort, and so the patient can going through this critical event of this life. So anything can interfere with the patient's safety. For example, even from the patient itself, neonates have different problems. Older patients have, senior citizens have also very different problems. Also, the patient have their coexisting condition. The patient getting older, they get other medical problem, for example, hypertension, high blood sugar. Everything can happen during the patient life. So one thing that we can do to ensure that we can deliver the safety, not only anesthesia, but also during the operative period to the patient, that's the challenge for anesthesiologists. As we know the patient well, and the other side is we have a good device. We can measure everything. We can know the exact condition of this patient, so we can guide the patient through all the their safety margin. Before we just measure by a clinical parameter, but we cannot do it anymore because we have older patients, we have more extensive surgery, so we need device to exactly know what going through the patient, so we can keep the patient always in good condition. For example, not easy even to guess how much fluid already in the patient, how deep is the anesthesia. Before if we only use clinical science, it's not possible to bring the patient into a safe condition during this critical period. We already use the anesthesia machine, and also we already use the ultrasound from Mindray. They develop very fast, and they have a good interaction with us as a user. So that's really interesting. One thing that impressed me is when I tried the new anesthesia machine at this time, the A7 that can deliver the low flow anesthesia. Before we know low flow, but more theoretically. But when apply low flow, so many things that we don't realize it before. The advantage of low flow, we see that advantage. This specialty have a very bright future. When I start 15 years ago, I don't realize that I love anesthesia, but I think in terms of with another specialty, we are less prominent before. But when the patient, when the society care more about safety, they will respect anesthesiologists more. So they need our country, for example, they start to feel they need more anesthesiologists to provide and ensure the patient safety on our medical system.